Hi, and welcome to today's Daily Chronicle. Today is Monday, April 13th, 2026. Latinos are pressured to speak English, but often shamed when they can't speak Spanish. Mark Ramirez, USA Today. About half of U.S. Latinos who don't speak Spanish well say they have been shamed by other Latinos for it. A Pew Research Center survey has found though 75% of all Latinos say they can speak the language at least pretty well. Latinos ages 18 to 29, the least likely age group to be able to carry on a conversation in Spanish, said jokes or comments about their limited language ability happen extremely or very often, significantly higher than all other age groups. It's really damaging because language is a part of your identity, said Lourdes Torres, a professor of Latin American and Latino studies at DePaul University in Chicago. So when you're told that your language is a problem, what people are telling you is that there's a problem with you. The Pew survey, conducted in August 2022, collected responses from a nationally represented sample of 3,029 Latinos. While 3/4 of all Latinos said they spoke Spanish at least pretty well, that was just true for just 57% of those born in the U.S., including 69% of higher generation Latinos and just 1 in 3 Latinos, 34%, who were third generation or higher. Among surveyed Latinos with limited or no Spanish language ability, 54% said families or friends had joked about or commented on their inability. The portion was slightly higher among those 18 to 49 years old, 57%, and highest among those with college experience, 61%. Language skills in U.S. fade with generations. About 62.5 million Latinos resided in the U.S. as of 2021. This summer, an interview with a young soccer fan conducted by ESPN Deportes, Jose del Valle, after Mexico's CONCACAF Gold Cup win in Inglewood, California, went viral after the Latino boy was unable to understand the reporter's questions. The exchange prompted criticism of the boy's parents for not teaching him Spanish. At a 2016 Republican primary debate, Florida Senator Marco Rubio attempted to belittle Texas Senator Ted Cruz's Spanish comprehension, prompting Cruz to respond in Spanish. While the U.S. has one of the world's largest Spanish-speaking populations, a familiar pattern plays out with immigrants. Torres says native language skills are mostly lost within 3 generations, with the first generation maintaining their primary language, the second generation becoming bilingual, and the third primarily speaking English. It's a pattern that the U.S. has unfortunately had for decades. Torres said linguists refer to the U.S. as a language cemetery. It's where languages come to die. While English isn't officially the country's official language, Torres said it's unofficially so. There's a push for people to learn English as soon as possible, she said. People are shamed if they don't speak English well. Both types of shaming, she said, illustrate what writer Gloria Anzualda has called linguistic terrorism, the notion that neither their English nor their Spanish is good enough. You're dealing with a situation where Latinos are continually faced with questions about their Americanness, said Jonathan Rosa, an associate professor at the Stanford Graduate School of Education in Palo Alto, California. Language is often positioned as one of the clearest signs people are seen as assimilating too much or not assimilating enough. Political and social pressures play a role. Such patterns persist because of political pressures like heightened anti-immigration sentiment and the xenophobia perpetrated by rhetoric such as Donald Trump's characterization of Mexican immigrants as rapists and drug runners, leading up to his 2016 presidential bid. In 2018, for instance, a New York lawyer berated a local restaurant staff for not speaking English in a video that subsequently went viral, accusing them of living off his money. "I pay for their welfare," he said. "I pay for their ability to be here. The least they can do is speak English." The man publicly apologized after being kicked out of his office space and drawing the ire of elected officials. Many Latino immigrant parents who experienced discrimination and humiliation for their limited English skills, Torres said, choose to raise their children to speak English, which is a shame. She added, given the cognitive benefits scholars have found in bilingualism. They don't want their kids to suffer the same harm that they did, Torres said. We're a country that, despite the rhetoric, is really hostile to other languages. Instead of looking at them as an asset, they're treated as a negative aspect that needs to be eliminated. Laura Munoz, an assistant professor of history and ethnic studies at the University of Nebraska, Lincoln, said the major force in generational language erosion is Americanization. The process has historically been linked to politics, she said. For example, in Arizona, where lawmakers in the early 20th century made English proficiency mandatory for voting rights. You had people who had been politically active who were essentially disenfranchised because they could not read or write English, she said, but they could pay taxes. It's not just saying you must speak English in order to be American. It's about terrorizing people with a law to force them to relinquish their language. Latinos lose family, community ties. When language is lost intentionally or by assimilation, it also tears at family and community fabric. Munoz noted, children lose the ability to communicate with their grandparents. People lose the ability to converse with their Spanish-speaking neighbors or the Mexican restaurant owner down the street. If you have a child growing up in English-speaking society, you want that child to do as well as possible, she said. Encouraging them to speak English is part of that. So there's this massive pressure on young children of Latino heritage to abandon their language. Rosa said the stigmatization of limited or imperfect language skills is frustrating, considering the incredible dexterity many Latinos have demonstrated in terms of their multilingual abilities. Not just in Spanish and English, but including indigenous languages and various Spanish forms. That gets lost in the discussion when you're just focused on what people lack or how much English or Spanish they know, he said. We're talking about a population that is incredibly linguistically diverse. The idea that people should speak one language or the other is incorrect, Rosa said. The melding of the two in itself can be a mode of maintaining history and heritage. That's what you can miss when you create the idea of a pure standard, he said. It's not a sign of failure, but a sign of navigating really challenging political, economic, and cultural circumstances. Killing us softly, the dangers of legalizing assisted suicide. This article is an overview of the problems with legalization of assisted suicide as a public policy. The disabilities community's opposition to assisted suicide stems in part from factors that directly impact the disability community as well as society. These factors include the secrecy in which assisted suicide operates today. In states where it is legal, the lack of robust oversight, and the absence of the investigations of the abuse, the reality of who uses it, the dangerous potential of legalization to further erode the quality of the U.S. healthcare system, and its potential for the other significant harms. Legalizing assisted suicide would augment real dangers that negate genuine choice. And self-determination. In the view of this reality, we explore many of the disability-related effects of assisted suicide, while also addressing the larger social context that inseparably impacts people with disabilities and the broader public. First, after addressing common misunderstandings, we examine fear and bias toward disability and the deadly interaction of assisted suicide and our profit-driven healthcare system. Second, we review the practice of assisted suicide in Oregon, the first U.S. state to legalize it, and debunk the merits of the so-called Oregon model. Third and finally, we explore the ways that so-called narrow assisted suicide proposals threaten inevitable expansion. The legalization of assisted suicide strikes many people. Initially, as a cause to support, but upon closer inspection, there are many reasons why legalization is a serious mistake. Supporters focus on superficial issues of choice and self-determination. It is crucial to look deeper. Legalizing assisted suicide would not increase choice and self-determination, despite assertions of its proponents. It would actually augment real dangers that negate genuine choice and control. Because of these dangers, approximately half the states in the United States have either defeated bills to legalize assisted suicide or have passed laws explicitly banning In many cases, the bills or referenda were defeated by an opposition coalition spanning the political spectrum from left to right. Throughout the world, disability rights advocates and organizations are important voices in the opposition to assisted suicide. The disability community's opposition is based on the dangers to people with disabilities and the devaluation of disabled people's lives that result from assisted suicide. Further, this opposition stems from factors that directly impact the disability community as well as society. These factors include the secrecy in which assisted suicide operates today. In states where it is legal, the lack of robust oversight and the absence of investigation of abuse, the reality of who uses it, the dangerous potential of legalization to further erode the quality of the U.S. healthcare system, and its potential for other significant harms. In view of this reality, we address many of the disability-related effects of assisted suicide, while also encompassing the larger social context of assisted suicide that inseparably impacts people with disabilities as well as the broader public. First, after addressing common misunderstandings, we examine fear and bias toward disability and the deadly interaction of assisted suicide and our profit-driven healthcare system. Second, we review the practice of assisted suicide in Oregon because its law is copied in proposals throughout the country, including Washington State, which legalized assisted suicide last year. By detailing significant problem with Oregon's supposed safeguards, we raise some of the dangers of assisted suicide, particularly for people with depression and other psychiatric disabilities. Finally, we explore the ways that so-called narrow assisted suicide proposals threaten easy expansion. This article focuses primarily on conditions in the United States, although much of it also applies to other countries. Few helped, many harmed. Disability prejudice and the damage to society. Legal alternatives available today. The movement for the legalization of assisted suicide is driven by anecdotes of people who suffer greatly in the period before they die. But the overwhelming majority of these anecdotes describe either situations for which legal alternatives exist today or situations. For which legal alternatives exist today or situations in which the individual would not be legally eligible for assisted suicide. It is legal in every U.S. state for an individual to create an advance directive that requires the withdrawal of treatment under any conditions the person wishes, and for a patient to refuse any treatment or to require any treatment to be withdrawn. It is legal to receive sufficient painkillers to be comfortable. And now we know this will not hasten death. And perhaps least understood, for anyone who is dying in discomfort, and we know this will not hasten death. It is legal in the U.S. state to receive palliative sedation, wherein the dying person is sedated so discomfort is already recourse for painful deaths. These alternatives do not raise the serious difficulties of legalizing assisted suicide. Moreover, anyone with chronic but non-terminal illness is not eligible for assisted suicide in either Oregon or Washington State. anyone with depression, that affects his or her judgment is also ineligible. Thus, there is already recourse for painful deaths. These alternatives do not raise the serious difficulties of legalizing assisted suicide. Moreover, anyone with chronic but non-terminal illness is not eligible for assisted suicide in either Oregon or Washington state. The number of people whose situations would actually be eligible for assisted suicide is extremely low, yet its harmful consequences would be significant. Fear, bias, and prejudice against disability. Fear, bias, and prejudice against disability play a significant role in assisted suicide. Who ends up using assisted suicide? Supporters advocate for legalization. By suggesting that it is needed for unrelievable pain and discomfort at the end of life. But the overwhelming majority of the people in Oregon who have reportedly used the state's assisted death law wanted to die not because of pain, but for the reasons associated with disability, including the loss of dignity and the loss of control of bodily functions. Similar reasons are reported in the Netherlands. This fear of disability typically underlies assisted suicide. Janet Good, an assisted suicide advocate who worked with Jack Kevorkian, was clear about this. Pain is not the main reason we want to die. It's the dignity. It's the indignity. It's the inability to get out of bed or get onto the toilet. People say, I can't stand my mother, my husband, wiping my butt. But as many thousands of people with disabilities who rely on personal assistance, have we gotten to the point that we will abet suicides because people need help using the toilet? The legalization of assisted suicide would occur within the context of a healthcare system and a society pervaded with prejudice and discrimination against people with disabilities. Already, this prejudice and discrimination play out on life-threatening ways, including pressure by hospital staff on people with disabilities who are nowhere near death to sign do not resuscitate orders and reject life-sustaining treatment. Because of public images that disability is a fate worse than death, legalized assisted suicide threatens to create a two-tiered system. Non-disabled individuals who express suicidal wishes will receive suicide prevention services, while individuals with disabilities will receive lethal prescriptions, resulting in death to the socially devalued group. A deadly mix. Managed healthcare and assisted suicide. An ailing system made worse. A significant problem with legalization is the deadly interaction between assisted suicide and profit-driven managed healthcare. Health maintenance organizations, HMOs, and managed care bureaucracies have often overruled physician treatment decisions because of the cost of care, sometimes hastening patients' deaths. Financial considerations can have similar results in nonprofit health plans and government-sponsored health programs, such as Medicare and Medicaid, which are often underfunded. Cost-cutting pressures also shape physician choices. A 1998 study from the Georgetown University Center for Clinical Bioethics found a strong link between cost-cutting pressures on physicians and their willingness to prescribe lethal drugs to patients who are legal to do so. The cost of the lethal medication generally used for assisted suicide is about $300, far cheaper than the cost of treatment for the long-term medical conditions. The incentive to save money by denying treatment already poses a significant danger. This danger is far greater where assisted suicide is legal. Direct coercion is not necessary. If patients are denied necessary life-sustaining healthcare treatment, or even if the treatment they need is delayed, many will, in effect, be steered toward assisted suicide. The deadly impact of legalizing assisted suicide would fall hardest, whether directly or indirectly, on socially and economically disadvantaged people who have less access for medical resources and who already find themselves discriminated against by the healthcare system. Particularly at risk are individuals in poverty, people of color, older adults, people with progressive and chronic conditions, and terminally ill individuals. As the New York State Task Force on Life and Law noted, assisted suicide, despite supposed safeguards, will be practiced through the prism of social inequality and prejudice that characterizes the delivery of services in all segments of society, including healthcare. Those most vulnerable to abuse, error, or indifference are the poor, minorities, and those who are less educated and less empowered.